Hello, everybody. Good evening, at least from my part in the world. And hello again to all those who participated in yesterday's webinar with Dr. Willett. Welcome to the second VegMed online event. As Dr. Greger will be with us for exactly 30 minutes, I'll be very brief with introductory words, and I would be more than happy if all participants could stay a few more minutes after the interview to get some news regarding VegMed 2021. Yes, we got a new date, and regarding the panel discussion tomorrow. I'm Niklas Oppenrieder. I'm the medical director of the Physicians Association for Nutrition, PAN International, and I am very delighted to host this webinar today, or this online interview today, on behalf of VegMed and the whole consortium, Charité University Outpatient Clinic for Integrative Medicine at Emanuel Hospital Berlin, ProVeg International, Stiftung Reformhaus Fachakademie, and PAN International itself. If you have any questions, please type them in the Q&A window, and Dr. Greger and Jens Tuider will answer them in the last few minutes of today's interview. Please note as well that this online interview, as well as the two other online events this weekend, will be recorded and published later via social media. So make sure you like and subscribe the VegMed social media channels, and make sure to let your colleagues and friends and family know. So this weekend, we are discussing some of the most urgent health threats: climate crisis, NCDs, pandemics. Maybe we touch AMRs as well today, as they are all linked very closely to the way we eat and produce food. Today's topic is for sure addressing the most acute crisis of these, as Dr. Greger and Jens Tuider will talk about pandemics and nutrition. So Dr. Greger will be interviewed by Jens Tuider. Jens studied philosophy with a focus on animal ethics and is now the international director and special advisor to the CEO at ProVeg International. He's currently leading the team writing the ProVeg Food and Pandemics Report, which will be published soon. So as this looks like the perfect basis for a great and informative interview on the world's topic number one at the moment, I'm very happy and thankful to hand over to the mic to you, Jens. Thank you very much.
Thank you, Niklas. A warm welcome to everyone from me as well. I'm very pleased Dr. Michael Greger has made time in his busy schedule today to join us for a live interview. As you might know, Dr. Greger is an internationally renowned nutrition expert and physician, public speaker, and the New York Times best-selling author of How Not to Die, the book many of you will know him for, as well as for his great work as an advocate for whole food, plant-based diets, with his organization Nutrition Facts. Unless you have done so already, you may wish to check out his website, nutritionfacts.org, jam-packed with valuable information about whole food, plant-based nutrition. What some of you may not have known, though, is the fact that Dr. Greger spent more than a decade of his career in public health research, specializing on emerging infectious diseases, to which, of course, COVID-19 belongs. This makes him the perfect expert for the current situation. After having taught us how not to die, he will today also shed some light on how to survive a pandemic. Welcome, Dr. Greger, and thank you so much for being on our webinar series.
I'm so glad to be here. I'm sorry I couldn't be with everyone in person. I was really looking forward to VegMed this year.
Thank you so much. So let's dive straight in. You've been doing research on emerging zoonotic diseases for quite a while. In 2006, you already published a book called The Bird Flu, A Virus of Our Own Hatching. And I've recently watched one of your talks on pandemic prevention dating back to 2013, where you literally predicted the current crisis in all its devastating detail. So being the expert that you are, COVID-19 probably didn't come out of the blue for you, did it? But why did your analysis and advice go unheeded? You must be feeling quite a bit like Cassandra, probably.
Oh, the entire public health community feels the same way. I mean, predicting another pandemic is like predicting the sun will come up the next day. I mean, we know pandemics are always a matter of when, not if. And the only question is how bad. And that is really, I think, the focus of my work. And that is that COVID-19, the silver lining here is that this may finally wake the world up to the coming threat that may be waiting in the wings, literally in chickens. In 1997, flu virus was discovered in chickens in Hong Kong that changed forever our concept of how bad pandemics could potentially be. And that is a virus H5N1 killing over half the people it infects. The current leading threat for the next pandemic is a bird flu virus known as H7N9, killing about 40% of the people it infects. So imagine billions infected and 40% of people dying. No one was interested in hearing about this very real threat, but now perhaps, as we look around the world, the countries best able to deal with this were ones that had previously suffered SARS outbreaks like Taiwan and Singapore, South Korea, a MERS outbreak in 2015, South Korea as well. And so that gave them a level of preparedness that enabled them to better weather the storm now. Likewise, COVID-19 may give the wake-up call that's necessary to really rethink how we raise animals for food, which is putting up at risk for the next deadly flu outbreak.
Right. What I keep noticing in all these debates about the causes of COVID-19 and how to prevent future pandemics, ironically, food and our animal-based food system receive only very limited attention, and people still fail to make this connection between food and pandemics. From what I understand, there are actually three behaviors related to our animal-based food choices, increasing pandemic risks. So first, there is the destruction of wild animals' natural habitats and the decline of biodiversity, which both are massively driven by animal agriculture, of course. Then there is the use of wild animals for food, and of course, the use of domesticated animals for food in animal agriculture, creating this perfect breeding grounds for pandemics. Could you elaborate on this connection and also on the relevance of these three pieces of the puzzle a bit more, maybe?
And in the current crisis, it's actually a fourth piece of the puzzle, which really fits in perfectly with what VegMed has been working upon. The fact that look at the major predisposing underlying conditions that increase one's risk for a severe case of COVID-19. Type 2 diabetes, obesity, heart disease, hypertension. Each of these diseases can be prevented, arrested, and even reversed with a healthy enough diet centered around whole plant foods. So even in the context of this pandemic, it's not just chronic disease risk that can be ameliorated by eating and living healthy, but also the risk of one dying from infectious diseases as well. If you remember my chapter 5 of How Not to Die was how not to die from infections, and it follows the very same trajectory. But to address your original question, indeed, most re-emerging diseases come from the animal kingdom. These are zoonotic diseases. So wait a second, we domesticated animals thousands of years ago. Why now? What has been happening over the last half century to lead to this unprecedented acceleration of the rate of emergence of disease? You mentioned a number of risk factors such as deforestation, the bushmeat trade, which led to the emergence of HIV, the wildlife trade, and these live animal wet markets, which led to the emergence of SARS, COVID-19. And then how we treat animals raised for food. Remember, bovine spongiform encephalopathy, mad cow disease, because we turned herbivores into, cannibals and carnivores by feeding them slaughterhouse waste, blood, and manure. And look, if you look at our last pandemic, 2009 H1N1 swine flu didn't arise from some backwater wet market in Asia, but was largely made in the USA on industrial pork operations. Thankfully, that was just a so-called category 1 pandemic, killing only about 500,000 people. We may not be so lucky next time. The last time a bird flu virus jumped species and infected people directly and caused a pandemic, it triggered the worst human tragedy of all time, the 1918 pandemic, which killed upwards of 50 million people. And the same, from the point of view of the virus, the same trench warfare conditions that led to the emergence of this flu virus of unprecedented lethality exists today in every industrial chicken shed, in every industrial egg operation, crowded, confined, stressed, but by the billions, not just millions. So, we may be one bush meat meal away from the next HIV, one pangolin plate away from the next killer coronavirus, and one factory farm away from the next deadly flu. You know, it may take a, you know, we don't tend to shore up the levees until after the disaster, but sadly, it may take a pandemic with a virus like H5N1 that wipes out millions before we, you know, realize the true cost of cheap chicken.
Right. Let's take a look at the solution landscape, Dr. Greger. Your new book, How to Survive a Pandemic, Overcoming COVID-19 and Preventing the Next Deadly Outbreak, is now available for pre-order as both an ebook and an audiobook. So congratulations on this most timely and relevant publication. What I like about it is the two-pronged approach about survival on the one hand and prevention on the other hand. Maybe let's start with the survival part. Would you like to share some of the tips on how to survive a pandemic? Are there certain kind of nutrients or foods that you would especially recommend eating in times of COVID-19?
Unfortunately, we don't know enough about this disease to know what parts of the immune system we want to ratchet up or down. So, for example, there is amazing data, which I've documented. I have over 100 videos addressing immune function and nutrition on nutritionfacts.org. And extraordinary research, like double-blind, randomized controlled trials, very rare in the dietary world, showing things like broccoli sprouts can dramatically decrease influenza virus loads in the nose, decrease virus-induced inflammation, boost antiviral natural killer cell activity. But again, we're not talking about the flu here. We're talking about COVID-19, and it's a new virus. We have no idea what we do or do not want our immune system to be doing right now. We know, some of the people dying from this disease are dying in, so-called cytokine storms, the second week of symptoms where it's really not the virus causing damage, but people's own immune systems. The immunosuppressed do not seem to be at higher risk for this disease. And since most of the lung damage may be done by our own immune system attacking our lungs, in this kind of virus-triggered overreaction, we want to be very careful about, eating specific foods or specific diets to modify parts of our immune system because we simply don't know enough. So it really just comes back to common sense measures to take care of ourselves, which is getting enough sleep, stress management, exercise, a healthy diet centered around whole plant foods to decrease the risk of these comorbidities. But until we know more, we don't want to. There aren't specific supplements or foods that have been proven and shown effective. I talk about zinc. I go into a number of things, and talk about the pros and cons. But we don't know yet the best way to manage this illness.
Right, taking a bit more of a preventive perspective. A lot of focus is on emergency response at the moment, quite understandably so. But looking into the future, do you feel that experts and decision makers are also looking into pandemic prevention rather than only preparedness? So into the causes rather than only the effects. How can we address the root causes of the current crisis to prevent future ones?
Yeah, unfortunately, the attention has not yet shifted which is understandable given the current crisis. But afterwards, I'm hoping this will not kind of get lost down the memory hole, and we'll really double down our efforts to look into changing the way we treat animals, since it can have such global public health implications. When we overcrowd thousands of animals in these cramped, filthy football field size sheds to lie, beak to beak or snout to snout atop their own waste, it's just a breeding ground for disease. We're talking the sheer number of animals, the overcrowding, the stress compromising their immune systems, the ammonia from the decomposing waste burning their lungs, the lack of fresh air, the lack of sunlight. Put all these factors together and really have kind of the perfect storm environment for the emergence of these so-called super strains of influenza. So these so-called factory farms are really a public health menace. What can we do? Well, we can give these animals a little breathing room. They're the ones who need a little social distancing. Even measures as simple as providing straw for as bedding for pigs so they don't have the immunosuppressive stress of lying on bare concrete their whole lives has been shown to significantly decrease swine influenza rates. But if we really want to do something beyond just tinkering around the edges, such as declaring a moratorium on all confined animal feeding operations, these so-called factory farms, as the American Public Health Association has called for. We really have to accelerate the movement towards plant-based milks, plant-based meats, plant-based egg products. You know, I mean, one need look no further than the dairy case at the supermarket to see what this new constellation of choices has meant for consumers and for the industry. I mean, here in the States, major dairies declaring bankruptcy. You know, I was involved in the largest meat recall in human history. 150 million pounds of beef recalled after undercover footage at a spent dairy cattle slaughter plant in California was dragging downed cows, too sick or injured to even stand, into the slaughterhouse for the federal school lunch program here out of concerns that they were violating safety rules to protect people from mad cow disease. But you don't have to worry about contaminated cattle brains in your oat milk, right? Plant milks are a no-brainer, no pun intended, and you see the same kind of things happening in the meat case as well, in terms of food innovations, which will help move society away from raising animals for food entirely, or you know, we could have our meat and eat it too by moving towards cultivated meat, growing meat from muscle cells themselves. Then you don't have to worry about food safety risks like intestinal pathogens, fecal pathogens, E. coli, Campylobacter, Salmonella. If you're growing meat without intestines, similarly, you don't have to worry about respiratory pathogens if you're growing meat without lungs. Not saying these necessarily the healthiest products for somebody, but from a pandemic risk standpoint, zero risk. Either way, healthier for global health, not just from a climate standpoint, but from a pandemic risk public health standpoint as well.
Right. With the COVID-19 most likely having emerged at this wild market in China, many people, to my mind, seem to associate zoonotic diseases with exotic wild animals. And even some experts deny something like this could also happen in factory farms, say in Europe or the United States, because of higher hygienic standards and so on. So you've just dispelled that assumption, of course, but how can we raise awareness about this? How can we transfer this awareness about the potential threats to the assumedly much more or safer standards we have in Western countries?
Yes, this concept that factory farms are somehow biosecure, I mean, let's realize to keep animals alive inside, they have these massive exhaust fans that can blow influenza virus literally miles downwind out into the countryside. It can be carried by flies. It can be carried by rodents. There's just no way you can keep a fly out of a hog cave. I mean, it's wishful thinking. In fact, just a few years ago, we had you had one of the largest bird flu outbreaks in history here in the United States, with a series of H5 viruses killing about 50, leading to the deaths of 50 million chickens and turkeys, which is what Eurasia has been facing with H5N1 since 2004. And the fact that this broke out in hundreds of operations across 20 different states here shows how lax the biosecurity is, how it could ever really be when you crowd so many thousands or even millions of animals at a single operation. And so I think it's as terrible as COVID-19 is, with thousands of people already dead, millions projected to die, billions under lockdown, trillions lost as markets tumble. Still, we may have gotten off really easily. We may be looking at a case fatality rate only about 0.5%. That's a category 2 or 3 pandemic. And, you know, the worst, flu virus in history, 2%, 2.5% case fatality rate. Right now, there are flu viruses on the planet Earth killing off nearly half of those of the hundreds of people that have been infected. Should a virus like that acquire easy human-to-human transmissibility, a pandemic like that could literally, end civilization as we know it. I mean, as terrible as COVID-19 is, food is still being restocked on the shelves. The internet may be slow, but it's still up. We still have electricity. We still have chlorine disinfecting our drinking water. We still have, doctors and nurses showing up to work. But imagine if it wasn't a 1 in 1,000 chance of someone in their 40s and 50s dying, but a 1 in 2 chance, a flip of the coin. It's those kind of situations where I'm hoping COVID-19 will wake people up to the reality of how bad it truly could get, and then put in that kind of perspective these major changes to our agricultural system, like shifting away from animal agriculture to these plant-based or cultivated meat solutions. That seems like a big shift, but nothing compared to what the world's going through right now. And this could nothing compared to what the world could be going through.
Indeed. Many people seem to believe that this current crisis will dramatically change the way we live. If you had 3 wishes to create change in the world as a consequence of the current crisis, what would they be? Let's say in the medical arena, in politics, and in the general public.
Wow. Well, certainly. So pandemic preparedness. I mean, we could see with the global supply chains, in terms of a lack of testing reagents and swabs and protective gear. Obviously, we'll do better in terms of stockpiling in the future. But this is kind of akin to secondary or tertiary prevention. In public health, secondary prevention of heart disease, for example, someone's already had a heart attack. You're trying to prevent the second heart attack. What can we do? But even more important, primary prevention, preventing the disease in the first place, or even primordial prevention, preventing the risk factors for disease in the first place. And the same thing with pandemics. Yes, advances in vaccine technology, as so much money is being poured into novel ways to produce vaccines, may indeed help ameliorate pandemics in the first place. But let's move steps earlier in the process, in the chain, and see what we can do to prevent the emergence of these viruses in the first place. And on a political scale, at least in terms of the scientific world, we've seen this tremendous coming together of scientists around the world and sharing data and transparency and this kind of unified voice, which is beautiful to see. Unfortunately, some of it isn't taken into account by our politicians as much as we'd like. The blue skies of the world in the most polluted cities in the world may help us think more long terms in terms of the climate crisis. There's some papers out suggesting that COVID-19 may have actually saved lives in China because the air quality was so bad that the number of preventable deaths that were eliminated by the decrease in air pollution, as many as 1,000 people in China may be alive day after day, saved every day because the air quality is so much better, which is more saved than being killed by a virus. That's how bad air pollution was. And maybe with the clearing of some of these skies, we will rethink jumping back in our cars and planes. Save our jumping back in planes for really important things like VegMed.
Thank you. I think we're running out of time a bit, I'm afraid. So I would like to pick at least 1 or 2 questions that our audience has for you, if you don't mind. One of the questions that is particularly relevant for this audience, I think, is how should health professionals get involved in the efforts for a sustainable food system focusing on plant-based nutrition, Dr. Greger?
Well, I think it's critically important that we play the critical voice within our institutions. So the reason that I'm able to speak at ground rounds in hospitals is because there's actually someone on the inside that's able to talk to someone that invites me in. That's how I'm speaking in medical schools. That's how I'm speaking at medical conferences. And so we can use our influence, our social authority as physicians to work in networks with other practitioners like the Physicians Association for Nutrition, to share resources, to share lectures, to bring that information in and share with our colleagues, work directly within our institutions to get healthier options in cafeterias, healthy food in the hospital. What a concept. I mean, these simple steps, I think will go a long way. We can be leaders in this fight, just as physicians were actually leaders in the fight against tobacco. The first workplaces, at least here in the States, to ban tobacco smoking were the hospitals, well before other businesses. And so we led the public health fight for healthier air. Let us lead the public health fight for healthier food, especially since chronic diseases continue to be our leading killers and will be again very soon once we squash down COVID-19.
There's one other question. In your opinion, how likely or unlikely is it that COVID-19 was actually produced in a lab and escaped by incident?
So it's important. There's two different scenarios. The produced in a lab, the manufactured in a lab with some kind of gain of function experimentation. That does not seem to be the case based on the genetics of this virus. If you look at this virus, it has acquired a human binding domain in a unique, novel manner. If you were creating this virus to infect people, presumably you would use methods by which the viruses have in the past acquired human attachment. And since this is a novel method, we presume that's good evidence that someone didn't create this virus in the lab. However, that does not mean, so it appears to be of natural origin. That does not mean it couldn't be a virus of natural origin that was being looked at in a lab and then escaped a lab. But the best evidence we have against that theory is the report of positive environmental samples of this virus at the Hunan seafood market, this Wuhan market, in the area where these wild animals were traded, combined with the fact that that's where SARS came from, the first deadly coronavirus outbreak, 2002, 2003, with this intermediate species, the civet cat, here in this case, with an intermediate species, presumably the pangolin, because we have about over 90% sequence identity in that critical receptor binding domain, found in two different sets of diseased pangolins being smuggled into the country. And so there's good circumstantial evidence combined with the fact that most of the first victims of this disease were tied back to the market. Now, of course, this is relying on reporting from the Chinese government, and there's certainly skepticism as how much we can believe the reports, particularly given their early censorship of whistleblowers, etc. But there does seem to be evidence that we are looking at a zoonotic animal to human originated in the primordial gene pool of bats through an intermediate species, likely pangolins, to the human population. Now, of course, animals are out of the picture. It travels from human to human. And because of global air travel, any virus anywhere is one day away from the rest of the world. That's why it's critically important to shut down these wet markets for good, end the trade in exotic animals, and change the way we raise meat.
Right, we're running out of time. We also want to be mindful of your time, of course, Dr. Greger. So we need to conclude here. We've learned a lot today about the connection between animal-based food choices and pandemic risks, about the whole food plant-based diet can help reduce the impact of infectious zoonotic diseases by helping us to avoid non-communicable diet-related diseases that put us in high-risk groups, and of course about plant-based eating as a long-term pandemic risk mitigation strategy. Thank you so much for sharing your insights on this urgent and pressing topic, Dr. Greger, and thank you for being on our webinar series. It's been a great pleasure and honor. For further information, check out the upcoming ProVeg Food and Pandemics report at proveg.com. And please also visit PAN's website, pan-int.org. And now back to you, Nicholas.
All right. Well, thank you very much, Jens, for this great interview, for getting all these important topics into just 20 minutes. And thank you all, of course, very much for dedicating your time to the topics of nutrition and food systems, while all of you for sure have to juggle a lot of different challenges in the current crisis. We do think that the continuous work on these subjects, especially right now, is important, as this crisis itself shows the fragility of healthcare systems and food systems as well. And as I mentioned before the interview, I just wanted to name 3 options kind of to continue this work and to continue the involvement with VegMed conference. So first option, of course, the panel tomorrow. That's the last of our series this weekend. We talked about the most acute crisis today, and we will talk about the most severe crisis, the climate crisis, its impact on health and its interconnection with our food, extensively in a panel discussion tomorrow with Dr. Marco Springmann, who is the co-author of the Eat Lancet report, and who has done and is still doing extensive research on the impact of food on climate change and planetary boundaries. Then there is Dr. Martin Herrmann, who's the co-founder and speaker of the initiative Health for Future and the organization behind it, KLUG, the German Climate and Health Alliance, huge network of health professionals and scientists around this topic. And there's Dr. Christian Kessler, who's a co-founder and organizer of VegMed Conference since its very, very first edition, and who's a senior physician at the Charité University Outpatient Clinic for Integrative Medicine at Emmanuel Hospital Berlin. So there is still the possibility to register for that panel tomorrow. Second option, of course, VegMed 2021, postponed VegMed 2020. We will, of course, we'll provide you with more online events throughout the year 2020. So make sure to follow the respective social media channels. But as I did mention in the intro, we do have a new date for the real one, live and in color, and for everyone in person, VegMed 2021 in Berlin. It's February 28th till March 2nd in Berlin. And for those who don't know, VegMed is Europe's largest medical conference on plant-based nutrition. So it's 3 days packed with science and practical learnings presented by some of the most renowned international speakers in this field. But it is of course as well a lot of delicious and healthy food. It's lively exchange among the participants and speakers. It's new networks. It's a beautiful atmosphere in and around the Henry Ford building in spring in beautiful Berlin. Plus, as the event this time will be on Sunday, Monday, and Tuesday, you got the chance to enjoy Berlin as the plant-based capital on Friday and Saturday before the event, if you'd like. So registration for tickets is open now. And there are still some remaining tickets. By the way, thank you very, very much to all those who kept their tickets for VegMed 2020, because they're still valid for VegMed 2021. So the majority of ticket holders did keep their ticket, and that really gives us as a nonprofit consortium the safety we need to organize this event. So thanks again. One last thing I wanted to mention, as we believe that all these crises just show how urgently we need a transformation of diets and food systems. If you want to support this transformation, please consider supporting VegMed and its consortium partners. If you're a health professional, please consider joining the Physicians Association for Nutrition to make nutrition a key part of healthcare and to engage more and more health professionals in the efforts towards a sustainable food system. And by the way, Michael Greger, whom you just heard, is part of our international advisory board. So thank you all again very much for participating today. I hope you enjoyed it, and I hope we will see you at one of the next online events, or at best at VegMed 2021. Have a great day, everyone. Bye-bye.